I was asked to talk today a little bit about Xadago. Xadago is the newest MAO-B inhibitor that we have. The MAO-B inhibitors are a class of medicine that have been around from, I would say maybe the late 70s, early 80s. And it was basically their purpose is to recycle the dopamine that the brain still makes. So it is, and the dopamine that you get from levodopa as it's converted over to dopamine and then released within the brain. It inhibits the breakdown of dopamine, so it's a recycler. And by doing that, it allows it to stay around in the brain a little bit longer so that it can work its effect a little bit more effectively. They're a complement to carbidopa, levodopa, or they are can be used by themselves as monotherapy. They're the three types of medications that fall into that class are selegiline, that's the oldest, rasagiline, that's the second oldest, the one that's probably been around and in clinical use most frequently, and then, like I said, the newest version is Xadago. With Xadago, that is one that does have to be used in conjunction with carbidopa, levodopa. It doesn't have the same indications as Azilect or rasagiline that it can be used by itself. The other difference is Xadago may work on other chemicals in the brain, not just dopamine. It may also have an impact on glutamate, which is an excitatory chemical in the brain as well, and can be part of the motor pathways. We know nothing happens necessarily in isolation. The dosing is a little bit different than the previous MAO-B inhibitors as well, though selegiline is a 5 milligram that's taken twice a day. Rasagiline is a 0.5 or a 1 milligram that's taken once a day. And Xadago is either 50 or 100 milligrams that's taken once a day. That's not to say that because it's such a larger number, it's a more potent medication. That's not it at all. It's just how they pharmacologically figured out the dosing and the milligrams that were most clinically effective. As far as side effects for the medication go, it's a relatively well-tolerated class of medicines. They don't have a ton of drug-drug interactions. There is something that always comes up when patients are on MAO-B inhibitors and also use antidepressants, which is really common in Parkinson's disease. There is a flag that usually comes back to them from the pharmacist. It is quite all right to use antidepressants and MAO-B inhibitors. That flag or that concern comes from a more general form of MAO inhibitors that are seen in the psych world that can have issues with blood pressure or other interactions like that. So that is something that obviously your doctor should be aware of, the other medications that you're taking. But for the most part, the drug interactions or concerns for MAO-B inhibitors like Xadago are far less than some other classes of medications and that are more general. As far as practically speaking, most patients that were in trials had the same side effects that patients in the placebo arm of the trial had as well. So very general things, a little bit more fatigue, maybe a little bit of mental fogginess, but those sorts of things improved over 2 weeks' time, whether it was placebo or whether it was in the patient's in the drug arm of the studies. So again, they're also well tolerated because they're medicines that help enhance the effect of carbidopa, levodopa. They are medicines that are meant to help enhance mobility. So sometimes dyskinesias can occur if your medicines are a little bit more potent and powerful. But again, that's something that can be either adjusted by adjusting the dose of the MAO-B or adjusting your complementary meds that you're on for Parkinson's as well. And that's about it for Xadago in a nutshell.